Dr. Eric Mandel is going to join us now. He's from Mandel Vision, medical director there. Doctor, the president early on closed the border to China, as we all know. This whole talk of stopping immigration, could that possibly not only help jobs, but also help from more cases entering the states?
Well, I think the world is probably more scared about an epicenter of this virus coming, which is New York, is the global hub, leaving than coming in. In theory, it's a gigantic shelter-in-place type of situation, and that's kind of what we were supposed to be moving away from. So I'll leave out the politics of this. More shelter-in-place means less of viral transmission. However, we're supposed to be wanting to open up the economy, and America, especially New York, is a global place, and we want to open that up as soon as possible. So I'm not exactly sure about this from a scientific point of view. I think maybe for our listeners, we really need to understand what is it we're trying to do. We know that this is a contagious virus. And so it may affect 1-2 people for every infected person, which means that if we didn't do anything, we didn't have any mitigations, containments, all these things, everybody, 80% of people would have gotten this sooner or later, and the consequences of that. So when we did all the severe mitigation, shelter in place, we decreased a much more important factor called the transmission rate. And that's what maybe this leads into regarding if we let people in or out of our borders. And the transmission rate means, let's say that if one person is infected, and the transmission rate is 1, it means they'll affect another person. This keeps going on. So we need to get the transition rate of infected people to way, way under 1. We don't know for how long we need to do that for. That's really what we're trying to do here. And I don't think that's really articulated well, from whether it's the mayor, the governor, or the president.
Sure. I have a little bit of time with you, but I want to make sure I get to a couple of topics. The president has been critical of the World Health Organization. I'm sure you've seen cutting off the group's funding there. The director's saying, we are not close to the end of this outbreak. Take a listen.
Trust us, the worst is yet ahead of us. Let's prevent this tragedy. It's a virus that many people still don't understand. Many countries were very developed, putting the wrong conclusions because they didn't know it and got into trouble.
The worst is still ahead of us. That's coming from the director of the WHO. But most U.S. states reporting lower numbers right now. Is he possibly talking about a rebound or a phase 2 of this virus?
I'm not sure. That could be a political response. If anything, listen, this has been a horrific situation, but things, I think, almost everywhere have been getting better. So when they say the worst is ahead, that doesn't make scientific or objective sense. But I think it's really a much more important problem. The public health officials are going to err on the side of being incredibly conservative. But decisions are not going to be made by the public health officials. They're going to be made by politicians. And it's that balancing act of when you get that transmission rate low enough for how long that you can reopen the economy and avoid, in a time where we don't have a vaccine or I'm happy to talk about medical therapies, but we really don't have one proven yet. So until we get to those points, then there will be cases that are there. It's all going to be about how do we contain this when we find the hot spot so they don't turn into waves. And because once we let the genie out of the bottle here and people are back out and there are some hot spots and you don't know where they are and they're not that close to you, to get those people and the contact tracing, put everybody back in for some more shelter-in-place orders, that's going to be a profound challenge.
All right. Good points. Dr. Eric Mandel, thank you for your time. We'll talk to you in about an hour.